Hello, my name is Arga. My student registration number is 121-0171-045.
Hello, I am Silvi and my number is 121017010056.
Hello, my name is Zuhal and my number is 12101711042. Today, we would like to explain about our infographic about tuberculosis.
Tuberculosis or TB is a potentially fatal contagious disease that can affect almost any part of the body, including the tummy, glands, bones, and nervous system, but it mainly affects the lungs. This disease is caused by a bacterial microorganism called Mycobacterium tuberculosis. Most infections do not have symptoms, in which case it is known as latent tuberculosis. About 10% of latent infections progress to active disease which, if left untreated, kills about half of those affected. TB is potentially serious condition, but it can be cured if it's treated with the right antibiotics. A total of 1.5 million people died from TB in 2018. Worldwide, TB is one of the top 10 causes of death and the leading cause from a single infectious agent. Although TB can be treated, cured, and can be prevented if persons at risk take certain drugs, scientists have never come close to wiping it out. Few diseases have caused so much distressing illness for centuries and claimed so many lives. But ending the TB epidemic by 2030 is among the health targets of the Sustainable Development Goals.
Tuberculosis is spread from person to person through the air. When people with lung TB cough, sneeze, or spit, they propel the TB germs into the air. A person needs to inhale only a few of these germs to become infected, but people are not equally infectious. Generally, it is only people with TB of the throat or lungs who are infectious. The strength of a person's cough can also affect the number of droplets released. Also, the most important factor is whether someone is on effective TB treatment, because TB treatment dramatically reduces the number of infectious droplets released by a person.
TB is a treatable and curable disease, active and drug-susceptible. TB disease is treated with a standard 6-month course of 4 antimicrobial drugs that are provided with information and support to the patient by a health worker or trained volunteer. The standard short course treatment for TB is isoniazid, rifampicin, pyrazinamide, and ethambutol for 2 months, then isoniazid and rifampicin alone for further 4 months. Without such support, treatment adherence is more difficult. Between 2000 and 2018, an estimated 58 million lives were saved through TB diagnosis and treatment.
Tuberculosis prevention and control effort rely primarily on the vaccination of infants and the detection and appropriate treatment of active cases. The only available vaccine as of 2011 is Bacillus calmette-guerin, or BCG. In children, it decreases the risk of getting the infection by 20% and the risk of infection turning into active disease by nearly 60%. The easy way to prevent TB are to wear a face mask. Don't forget to wash your hands when you are from outside or when you have touched something. And always eat healthy food. The World Health Organization has achieved some success with improved treatment regimens and a small decrease in case number.
Common symptoms of active lung TB are cough with sputum and blood at times, chest pains, fatigue, lost appetite that can cause weight loss, fever, chills, coughing continuously that lasts 3 or more weeks, and night sweats. Many countries rely on lung use method called sputum smear microscopy to diagnose TB. Trained laboratory technicians look at sputum samples under a microscope to see if TB bacteria are present. Just so you know, tuberculosis is particularly difficult to diagnose in children.
PPE, or the personal protective equipment, is an equipment used to protect medical, lab, or sometimes military personnel when conducting operation involving biohazard or radioactive hazard. Basically, this equipment covers your entire body so that no microorganism could contact with your body, meaning there is minimum escape heat inside the suit. Workers who wear this equipment usually experience liquid loss up to 1.5 liters of sweat every hour. All right, that is all for our presentation this time. Thank you for your attention.